Hello, I am Dr Ashlesha at the Medical Prime Clinic. When considering effects of the menopause, women complain about hot flushes, sleep disturbance and low mood as some of their more frequent symptoms, and they will turn to a health professional to help them with this. However, there is a lack of awareness of other very common symptoms that can cause great discomfort, and these can be hugely underreported and also undertreated. Genitourinary syndrome of menopause, GSM, is a term that describes vulval, vaginal and urinary tract symptoms that can occur due to low estrogen and affects women during and after menopause. Studies have shown that 70% of women will experience these symptoms, but only a quarter of these will speak about their symptoms to a doctor. Many women are suffering in silence, thinking that these symptoms are just a normal part of ageing and that nothing can be done to alleviate them. Women do not need to suffer, as there are a variety of treatments available. So why does GSM occur? We know that as women get older, estrogen declines, and this affects the delicate tissues in the vagina, the bladder and the urethra. The lining becomes thinner and more fragile. Vulval and vaginal symptoms include dryness, itching and bleeding. Walking and even exercise can be uncomfortable. Women can also experience reduced lubrication, leading to pain and discomfort during sexual activity. The urinary tract can be affected, and this can increase the frequency of passing urine and the feeling of an urgency to pass urine. Some women find that they get recurrent cystitis or urine infections. These symptoms can have a significantly negative impact on self-esteem and quality of life. They can affect women's sexual relationships, their ability to leave the house and interact socially for fear of being too far from toilet facilities. Well, the good news is that treatment is usually safe and extremely effective. Conventional hormone replacement therapy, HRT, can significantly help. In addition to this, estrogens delivered locally to the genital area can be applied long-term with no associated risks. They will improve the lining of the genital tissues, increase moisture and lubrication, and make exercise and sex more comfortable. These local estrogens come in the form of creams, gels and vaginal tablets that are used initially daily, then twice weekly. There's also a soft estrogen ring that can be inserted and changed every 3 months. Vaginal moisturizers and lubricants that can be bought over the counter are also helpful. These don't contain any hormones and can be used alone or alongside hormonal options. Moisturizers can help the vaginal tissue feel more hydrated, and lubricants can also be used before sex to make it more comfortable. It is best to avoid soaps, perfumes and irritants. It can take a few months of using these products to achieve full benefit, and it is recommended that these are used for long term, as stopping them can often cause a recurrence of symptoms.